Good afternoon, communications class. Today I'm going to be doing my speech as an inspirational speech on grabbing a hold of your health care prior to any major health conditions popping up. We always have the opportunity to take hold of our health, whether it be by walking, we stop smoking, limit our alcohol intake, take the proper medications that we're supposed to take. If not medications, then taking some sort of vitamin supplements. We live in the great state of Washington, but let's be honest, it's summertime and we haven't gotten much sun. So some people like to take vitamin D supplements. Whatever the case may be, grabbing a hold of your health care, again, prior to having some sort of major health crisis is always the best way to go. I'm going to show you one of my little handouts that I use at the clinic that I work out. It's called my self-management goal sheet. I'm going to zoom into this just a little bit. This just kind of goes over everything that I just mentioned to you guys. You want to make sure that you're eating a healthy diet. Get out and be physically active. One of the providers that I work with encourages our patients to walk 15 to 20 minutes per day. That definitely is a good mental clearing agent, as well as good for your health. Next one again is take my medication. So if you are supposed to be taking blood pressure medications or diabetic medications, any sort of medications, make sure that you're taking those as prescribed on a daily basis. No added salts. So that's a pretty hard one, but avoid processed foods, avoid eating out often. Having a lot of salt in your diet definitely increases your chances of high blood pressure or heart disease. Next one down here is monitor my blood sugar and monitor my blood pressure. So really this is more for patients or people that are already diagnosed with diabetes. You really don't want to check your blood sugar unless you're having some sort of symptoms on a daily basis, and I totally get that. If you do have diabetes, per your provider, you should be checking that blood sugar every day. Checking your blood sugar or blood pressure, you can do that on a daily basis. Some of the signs to look for high blood pressure are headache, dizziness, lightheadedness. So you can go to your local fire department and they can check your blood pressure for you, or even come into community health care. I'd be happy to check your blood pressure on a daily basis. Coping with stress. So here's another little handout that I give to my patients. Behavioral health services. If you aren't able to get access to these, there are plenty of other services, especially through DSHS, that would be happy to help you get in contact with someone that can talk to you about your mental status. Limit your alcohol. So I know earlier in the quarter I had chatted with you guys about how to make the perfect mimosa. We definitely need to limit those things and drink in moderation. Once a week is sufficient or not at all. And then stop smoking. So that is 100% what you need to do if you want to maintain a healthy lifestyle. Is you want to stop smoking. Nicotine in your system is just asking for a pyramid of different health concerns. Lung disease, throat disease. It can also complicate any of your other medical conditions that you do have. Here's another little handout that I do give to my patients. This is for a diabetic patient, but I do have sort of a diary thing for checking your blood pressure. On here, it's a little grid so you can put in the date and the time and what your reading was. This is a good way to kind of fold it up, put it in your wallet, and keep track of your health maintenance. Same thing with our diabetic cards. You can check your blood sugars on a daily basis, keep track of your medications, log your food. This is a good thing that I give to my patients on a daily basis. For women, we definitely want to be making sure that we're doing our monthly breast exam. Some of the qualifications or recommendations have changed over the past couple years, so definitely get in contact with your provider to see when it's best for you to do a breast exam or to also get a mammogram. Colorectal screening. So with my company now, we actually are doing this instead of making our patients have colonoscopies done. So again, get with your healthcare provider to see what option is best for you. Taking advantage of the resources that you have, whether it be your family doctor or any local resources, getting out there and walking, drinking water. There are plenty of things that you can do to take hold of your health care, again, prior to having a major health crisis. I know that working in healthcare, we try to keep a lot of our patients out of the ER. Again, that is all because you continue to follow up with your provider and take hold of your healthcare. I hope that you guys enjoyed my presentation today. Good job on the quarter, and I wish everybody the best. Thank you.